Thank you, everyone, for joining us today on the One Focus, where we help busy practitioners lean into one thing and help us learn from one another. Today, I have another amazing opportunity to speak with Mark Hinton with eYeFacilitate. I had the personal privilege of bringing Mark into my practice for a 2-day training with our entire staff, where we were able to learn and uncover things that we could do better as both optometrists and then getting our patients and practice into this optical selling mindset. So Mark, you brought something up that piqued my interest, where you said we have to engage the patient, or we've been engaging the patient all wrong when it comes to our opticals. And why is it important that we understand the difference between prescribing and recommending? What's the why there? And give us a little insight behind what you do.
Okay, well, the why is that prescribing is important and recommending is a suggestion. And suggestions are just suggestions. So, in many medical disciplines, the doctors prescribe, they don't recommend, and they prescribe with reason. And the reason is the why. In our cases, patients don't buy in if they don't understand, and if we didn't engage them to buy in. And the reason I share we've had it wrong is we look at it wrong. We look at our optical as retail. We should look at the optical as an optical pharmacist and not as pharmacy. And recognizing that our frame lens specialists, our optical experts, are truly they're optical pharmacists. They should be filling the prescriptions. And it's interesting because I worked with a practice a number of years ago, and the doctor said, I wish I knew what patients were thinking after they left the exam room. And I said, well, let's ask them. And ultimately we did. We brought 20 patients into the practice from all generations. And we asked them questions to help us understand where we confused the patient. And they were absolutely thrilled to help with that. 19 of the 20 people said, shouldn't the optical already know what I'm supposed to be getting? Why are they asking me if I'm interested in, have I heard of, have I ever considered, did the doctor say anything about? That was unnerving. Do they get an extra commission? Is it even owned by the doctor? These were things that we heard. That was 19 of 20. 18 of 20 said, I'm unsure and confused about what to do when I get to optical. In the exam room, it really is appropriate that the doctor says, I'm going to prescribe for you today, and then whatever it is, and then the reason I'm going to prescribe it. And for example, Brianna, when we talk about transitions lenses and prescription sunglasses, it's vitally important that the patient understands that without that, there's a potential risk for vision loss over time from sun damage, not UV rays, sun damage. And then if you express to me, I want to prescribe this to protect your eyes from sun damage over time, to reduce your risk of vision loss, can you see where this will be a good decision for you? So what you're hearing there is we need to close the patient, because typically we talk at the patient or we talk through the patient. At this point in the handoff, so Carol decided that it was important to include her sunglasses to protect her eyes from sun damage and reduce the risk of vision loss over time. Carol, you're in good hands. Mark is going to fill your prescriptions exactly the way I prescribed them for you. And Brianna, in this brief interview, if your listeners were to use that I just shared, sunglasses are going to increase, because we got to the reason why we would want it to increase. Does that make sense?
It does. And one last thing to wrap this up is, how has it made your job easier in the optical when the doctor prescribes and doesn't recommend? Because the word recommend has now become a bad word in our practice since you came and visited us.
Yeah, good.
Why is that so critical in this handoff and the success for something that makes you 65 to 75% of your income?
Well, the reason very simply is because the doctor and the patient have a trusting relationship. So in the exam room, the doctor builds the house with the patient and doesn't hand the optician a bag of bricks and say, good luck, or I hope that you're able to do something with this. Patients don't buy the opticians. They like them, but they buy their doctor's advice. When you go to your doctor, when your listeners go to their doctor, when I go to my doctor, I'm expecting my doctor to advise me what's important and then check in with me to see that it's important for me as well. And when it is, all your KPIs increase. And it's far more caring. It's empathy, it's care, it's compassion, it's absolutely concern as well. And that's where we need to look at this and not look at it as we need to sell glasses. Wrong approach. In the end, sell rhymes with hell.
Well, thank you so much, Mark, for joining us today on our One Focus. As you can see, there's a lot that we can do to help our opticians be successful. So just a little focus change on just a couple of words between prescribe and recommend. There's your little tidbit for today. So with all of that, everyone, now go activate your One Focus.